Welcome to Forum 360 on Fusion, your PBS channel and your Rubber City radio stations. This is Leslie Ungar, your host today. Thank you for joining us on our global outlook with a local view. In reading about today's topic, I came across a phrase that stuck with me. I honestly don't know if it was a typographical error or if it was written on purpose. In describing a small town while on a medical mission, the town was described as dotted with little stories. And I wondered if it was supposed to say dotted with little stores or little stories. And then I realized that every step of a medical mission in another country would be dotted with stories. Today we have two special guests whose medical missions have taken them around the world, bringing medical care to those who, unlike us, are not privy to health care on a regular basis. For much of the year, they are mere mortal physicians, donning white coats, going to an office and seeing patients on a daily basis. And then they turn into Superman and Superwoman as they literally fly through the sky to another country, another culture, to administer health care. Please help me welcome Dr. Deb Plate and Dr. Kevin Baldie. Both in the last 2 years have gone to Peru and Haiti. Welcome to both of you.
Thank you, Leslie.
Thank you so much, Ms.
So,
Unger.
to my Superman and to my Superwoman physicians. Let me start out, Dr. Plate, by asking you, why? Why do you do it? Why do you go? Why do you leave your families, your comfort, your routine, your jobs, your income for a few weeks? You're leaving a lot of different things. Why do you do it?
You know, it's interesting, as Kevin and I know, if one of us were to leave, or both of us were to leave our current practices for a period of time or for a long period of time, there would be other docs that would take over for us very nicely. We are both work on teams, and we would have that. If somebody were to leave where we have been in these remote areas of Peru and Haiti, there would be no one. And so it's a very different environment, and it really, you know, many of us are drawn to healthcare. All of us who are physicians are drawn to healthcare with a commitment to help others. And there is much that we do here in the States in addition to a whole nother learning experience that occurs in abroad from the
But
States.
you know, a lot of people are just happy with helping here.
Right, absolutely,
So
a lot to do.
there's something that has to be in you to leave your homes, pack up, go to more primitive,
Right, very
primitive cultures. Why do you do it?
Well, it's very interesting that you ask me that. You know, all my life I've always had a passion, you know, for service and medicine, and I always wanted to, you know, bring the two together. You may not know, but I'm a first-generation American, and my parents are actually of Jamaican descent. Both of them grew up in Jamaica. My mom was born in England, but all of the family is from Jamaica. And my dad, in particular, is from the countryside of Jamaica and the Manchester area, basically a farmland. And I was able to, you know, be fortunate to have some experience visiting as a child in my youth to appreciate a lot of, you know, the amenities and the lack of infrastructure in a lot of areas in certain parts of the world in Jamaica. And you know, I've always wanted to travel in other parts of the world as well and be able to give back, so that I knew that this would always be a part of what I would be doing in terms of a part of my service, in terms of giving back to the community, whether at home or abroad. And I finally got the opportunity to do that through our Global Health Initiative at Akron General.
Now, your parents will be at your graduation?
They will be. So
They're going to be two pretty proud parents, aren't they?
Oh, absolutely.
Yes, they
I'm
will
the first in my family to pursue a career in medicine, so this is a particular honor, and you know, I take a lot of responsibility for that as well, in leading that way and leading that charge, and also not forgetting, you know, where I came from, where my family came from, and being able to, you know, serve others in that respect.
Well, let me be the first, or perhaps not the first, but the first publicly to say congratulations.
Oh, thank you so much, Leslie.
Now, you two just don't go to another country. You go to another country and choose to go rather off the beaten path to administer to people who perhaps have not had the vaccines that we have. How do you prepare? You know, it's one thing to prepare to go to, you know, Paris or London, but how do you prepare to go to a more primitive area? Like, what do your suitcases look like? And what do you send as far as the medical supplies?
Kevin?
Well, this is interesting. When we first, our first trip together in global health, we went down to Haiti as part of our Heart to Heart initiative. It's an initiative that was started in 1992 in Haiti, and they were, basically focused on relief efforts, and then as well as long-term care. After the earthquake in 2009, 2010, the Haiti earthquake that affected, ravaged millions, the Port-au-Prince area, the capital of Haiti. There was a lot of devastation, and Heart to Heart had always, had been there for the better part of a decade at that time. So, I know that there's an issue with a lot of, bringing supplies to the area. So that's something that we learned firsthand when we were going down to Haiti last year, when we spent some time down there in March of 2015. We ended up, bringing a lot of well-needed and badly needed supplies to the area. There was a dearth of supplies, after that earthquake, and also in some of the more rural areas that may have not have been as affected by the earthquake, but were affected by a lack of a government infrastructure to help them out. So we were bringing down, over-the-counter supplies, whether it's medications, whether it's gloves for providers down there. We were able to do that and ship that down and bring that with us when we were able to go down there in March of last year.
Now, do you ship your supplies ahead of time? Do you take them all with you so they
We
get
take them
there?
with us, don't we?
We do.
Because they say if you ship them ahead of time, you may never see them again.
That's what I would worry about.
right.
So you have to take everything with you.
Right. One of the big things this year in Peru were children's vitamins. They have no access to children's vitamins. So all of us had our Flintstone chewables. You can't take
So like
gummies because
how
they
many
melt.
how many like hundreds of bottles?
Hundreds and thousands of,
Yeah.
and they were gone. We saw loads of patients that week, and they were gone by midweek, the vitamins.
Now, when we travel, in today's world, maybe we should get some kind of immunization or something, but we don't. We get on a plane and we go to Europe or
Right.
somewhere or other. But how early do you have to physically start getting ready? And what does your getting ready look like with your own shots or your own immunization or different kind of health insurance? And I have to ask you, do you have to make sure your will's up to date?
Well, that's a very good question, Leslie. I'm not sure about the will, and that's something that we discussed. But the beauty of our program here at Akron General, when we were working with Global Health, is that we were able to meet collaboratively as a group on a month-to-month basis and kind of keep up with the literature in global health arena. Not to mention, talk about each other's experiences from prior years, and help inspire us in doing what we needed to do to be best ready and prepared for the work that would be ahead in each of our respective trips.
And one of the things we did come to was
Yes.
evacuation insurance. So
Yes,
when
we
you
did.
talk about some of the things that could occur, evacuation insurance is a must. So that if there ever was a concern, we would be able to get out as we needed to, which is kind of interesting.
Right. So there was
Absolutely.
evacuation
Yeah.
insurance.
Yeah.
There was also medical provider insurance as well, which is important for us to have down there. But on top of that, in terms of the immunizations, we had to basically the CDC is a great forum for finding out whichever country or developing nation that you are visiting. They'll be able to provide you with the tools you need to know, or at least a guideline as to what immunizations are strongly required or recommended, and you're able to go to either your primary care provider, or if you're working in a hospital setting, the situation, the hospital that you're working with, in order to get those supplies and those immunizations.
So what's like one of the weirder immunizations that you had to get?
Typhoid. we
Yellow
got it,
fever,
right?
we got it right
Yes.
before going down to
Yes.
Peru. That was something as well.
Malaria prophylaxis we take before we go.
And there
All
were
our
varying,
tetanus are up to date.
sorry,
Yeah,
Dr.
go
Plate,
ahead.
there were
Yeah,
actually varying forms of the malaria prophylaxis
right.
as well.
Yeah.
Some of us, took something called doxycycline, which is an antibiotic, and let me tell you, it can cause a lot of GI
lot of-
disturbance. Absolutely, and you're
Part of
taking
your
that.
system.
It can be worse than the
Yes.
for lack of a
Yes.
better phrase, and you're basically taking that for a month straight,
Yeah.
before, a week before,
Real
and 3
commitment,
weeks
wasn't it?
after the trip. So
Right.
very, very serious stuff.
Now, you get there, so you land,
Right.
and then what? How do you get where you're going, and how do you know where you're going?
At both places we went with very organized groups, which was great. And again, many folks sometimes will go down and do their thing and leave. We always make sure with whatever tract we're doing, we leave a footprint. In other words, we go down, we join a force that's there all the time and work with them.
Now, would they be doctors from other places that
That's
come
correct.
also?
Or with Heart to Heart International, as Kevin was mentioning, and with Amazon Promise, as we did this last year.
So how far, like once you land, and you landed, when you went to Peru, you landed in?
We landed in Lima, which is the capital of Peru, a very large city down in South America. And from Lima, we took a direct flight from Lima to Iquitos, which is on the western side of Peru. And from there, we went to the village that we practiced in.
2 hour bus ride.
Two-hour bus
A
ride.
2-hour
To
bus ride. So
Nauta.
you said kind of bye-bye to civilization.
Right.
We pretty much did.
Right. Yeah.
Yes.
And then, so you go from a home with electricity and beds and running water, and what kind of lodging did you have when you were in Peru?
Well, the thing about Amazon Promise is there's several different venues that we can go to. So fortunately, there's some places in Nauta or outside of Nauta in western Peru where you're basically up in a tent and living in the jungle, which is what they call it, the Amazon jungle. We were actually pretty lucky. We had a little bit of electricity and a little bit of air conditioning as well.
Although
but
during the day in the clinic.
during the day in the clinic, we did not
horrific,
have
wasn't it?
anything like that. So that was the perfect part. So, in terms of the humidity, that's something that was a major thing to get used to. One of the things that they did mention to us going down there in terms of our own supplies is we definitely need to hydrate. Because Patty Webster, the founder of Amazon Promise, started the foundation organization back in 1993. She basically told us that every trip that she went on with a lot of the U.S. providers, at least one person would have to be hooked up to an IV.
We were bound and determined. that
Did
we
you
were
have
all
anyone?
gonna-
Did you have
no,
anyone
we
hooked
did very
up?
well. But so
No.
you drank salt all day long because you were perspiring so
You drank
much.
salt?
Salt. I mean, it's basically
Right.
a salt.
Oral
drink.
rehydration solution is what they call that as
Exactly.
well.
Yeah.
So salt mixed in with the water, kind of like Gatorade, but a little bit with a little bit more solute.
Now,
So,
there's a group right
yeah.
now that's down there for 2 weeks that is remotely in the Amazon jungle, serving small villages that are really remote. So you can really pick and choose how remote you want to be.
Now you are administering health care, and so you're able to do positive things, but at the same time you have to see all the things that you can't do. So how do you, Dr. Plate, how do you reconcile that? Yes, you're doing good, but at the same time there must be a lot of things. Can you give us an example that you see and that you
Oh,
can't?
so hard. We did a home visit. Well, Kevin and I and the group were in a small little village that we had gotten to by boat on a rainy morning. They asked me to go with this woman who came. She was probably about 80. And when she said, come with me, I thought she was just down the path. But oh no, we probably walked a mile to get to this home. And these homes are small wooden shacks. We get in there and her husband is dying of cancer. Most likely liver cancer is what it looked like. In a lot of pain, uncomfortable. And that was very hard because for him to get to the little town that we came from would be almost inconceivable. And so what I did is I went back and I got one of our colleagues, Dr. Mason, who has been a surgical resident in the past. He came and started an IV and gave this gentleman fluid. We got him comfortable and settled things down, and he had a period of comfort while during that time we could talk about what are we going to do next for this man to keep him comfortable, because he was really at the end of life. And remember, when we go into these homes, he is literally lying on a board like this table, and that to them is their bed and acceptable. So what would not be acceptable for us here was really very rough there.
Now, on your first trip, for you it might have been Haiti, for your first trip, whenever it was, can you remember some things that you took that you really were never going to use in the jungle, or something that you really wish that you would have taken?
Well, hair dryer would have been something I probably would not use, because you're lucky to have electricity in a lot of these places. So that was one thing that I thought, why did I take this up in my suitcase when I could have brought so much more? So that's why Kevin probably doesn't have that.
No, not so much right here. But one thing that I did actually bring that I found useful that for a different reason, interestingly enough, as a mosquito net in Haiti. I was worried about the mosquitoes there a little bit, but we didn't have to worry too much about that because we were spraying constantly.
Yes.
But one of the times we went to the city of Belance, which is in the Sud-Est region of Haiti, is the roaches. So I have a fear of roaches growing up, for some reason, based on my mom's, basically apprehension towards them. But the first night we got there, we went to the restrooms and talked about electricity. There's limited electricity. They only have it on for about 3 or 4 hours out of the evening, and then they shut it out the rest of the night. The bathrooms did not have any electricity, and once it got dark, you're basically fending for yourself. So first thing I did when we got there, it was a basically 7-hour trip from Port-au-Prince to the Belance area. Went into the restroom, and as I was washing my face, I I see something, moving. The wall's moving a little bit. I'm like, what's going on here? So I look back. I actually get my flashlight, and there's
Sure
about a 2 to 3 inch cockroach here, palmetto bug. And I was crawling up the wall, scurrying around, and I basically proceeded to leave the room and I didn't go back for a little while. So it took me a little while to get used to
Wait
that.
till daylight.
So one of the things I did was, the mosquito net actually came in handy to prevent roaches from crawling around me at night as well. So I do appreciate that.
Today we are talking with two individuals that have made medical missions to underprivileged parts of other countries in their free time. While we may be going to a beach or skiing, they're going on medical missions. And so today we are joined by Dr. Deb Plate and Dr. Kevin Baldie. Fears, whether it's that goes in waves, it was Ebola and now it's Zika, there's always seems to be some kind of a scare. What is it about people who go on these missions that you go toward scary things and scary places when most of us go away from them? Does anything scare you away from going?
I think we have such a passion for what we want to do in caring for others that I think that really overrides a lot of the fear that you might have. Safety is a big concern. So we're always concerned about safety, and we're very careful which group we are aligned with when we go. Cleveland Clinic, Akron General have both been very supportive of our efforts, but they're also very cautious. So there's a lot that goes on before we even travel, Leslie, as to who, where we're going to be and what's going on. So, but safety is certainly a big concern.
Now, from your perspective, and I know that you may not be an expert on it, but the Olympics and the Zika, from if you were advising an Olympic athlete, would you tell them to go?
Kevin?
That is a very difficult question. One thing I was going to add to Dr. Plate, what Dr. Plate was saying is, there were concerns a little bit about the Zika virus at the time we went down to Peru. Now there was only one case that was reported in that country, and it was actually an individual that had traveled to Colombia and had contracted the virus at that point in time. But he was quarantined on the way back. And let me just put it out there that there had never been any subsequent cases, at least from what I've heard, and they've done a great job fumigating the area. But in terms of, you talked about our fears. It's, the trick really is not so much ameliorating our own fears going down there, it's our family members.
Right, so true.
And I remember,
So
my
true.
wife or her family, my parents
My
were like, what are you going
mother's,
down there, getting the Zika virus? Are you guys going to have children after that? Or, things like that. So there's things that you have to take into account when you're going down to these places. So it's not just you that you're bringing down and putting yourself at risk. It's, you have to think about the family as well, but you also have to, prepare them with those tools and let them know how prepared you are going down there, so it'll help give them peace of mind while you're down there as well.
And we're very serious about coverage, aren't we?
Oh,
While
we
we're
are.
there, we're very
We are.
serious about that.
Now, do you have to prepare yourself? Like you're running the Boston Marathon. Do you have to prepare yourself physically? Like, do you have to start like working out like months before you go, or doing more miles? As you said, you would walk a mile once you did this boat with perhaps equipment and everything. So, do you prepare yourself at all physically for the trip?
I think we were aware when we were in Haiti, we were in the Highlands. And so we had a sense that we were going to be in the Highlands. So I know Dr. Green and myself, who are the older faculty folks that took the younger generation here, wanted to make sure that we were able to keep up and do what we wanted. So I know there was great effort on our part to make sure. But Kevin, do you feel like there was anything in preparation?
It was more so, I guess, the preparation physically. I wanted to, it was more so, getting used to. I guess the food selections, not so much of a problem for me. There were some individuals that were a little apprehensive. I'm not going to name names, but before we went down to Peru, for instance,
They served us piranha.
They did serve us piranha. There was alligator that was served as well. That was
Yeah.
caught in the nearby Amazon River,
That's right.
and it was something that was cooked basically in the streets of Nauta, and
That's right.
it's something that there's an unusual food choices that are outside of the mainstream touristy area. So if you are adventurous, you are definitely more than willing to.
And it's so welcomed by the community too. It's a big deal that you do join them in their effort.
So you do have to prepare yourself for that. But once
Absolutely.
you get down there, the food is great. We had a great cook that was down there as well,
Traveled
helping
with
us
us.
out.
Now, did you take like anything of your favorites with you so you wouldn't have to live without chocolate or without something? Did you take any of your own?
We actually took protein bars because we're told there's no time for lunch. You literally start working at 8 in the morning and go straight through. So, most of us packed protein bars and things along those lines. In Haiti, what we didn't realize is when you finally grabbed a chance to eat this little protein bar, there would be about 25 children around you and you couldn't eat it. So you ended up divvying it up and not eating anything and making sure that the children got it. So an interesting concept. To have it was great, but to eat it was not possible.
Right, but in both locations, we actually did have 2 great cooks in Haiti as well as Peru. So prior to each outing, we were able to have a great, large breakfast. Went to the sites, and not so much in Haiti, but in Peru, we were able to eat lunch there. We had a break time that was scheduled for us for about half an hour or so, then got right back to work, and had a pretty good dinner as well. So food wasn't so much of an issue. The main thing, as I mentioned earlier, was that oral rehydration solution, and we mentioned that. Just make sure to hydrate yourself, and you should be good to go.
Now, let me ask each of you, what is one of your best memories, whether you want to pick Peru or you could pick Haiti, but what's one of your best memories from a medical mission when you think back to where you've been?
Best memory for me with this recent Peru trip, first of all, it was a fabulous trip, great group, well-run group that she offers, or an experience that she offers. But we had a young girl who had come in with chronic headaches, and she had glasses. She was out in this village, remote village, and the glasses had broken with her doing something, and chronic headaches every day. And myself, Dr. Schmalstig, and Dr. Green elected to pay her way to come back to the city, paid for the doctor visit that she could never have the opportunity to get. We were there at the eye exam, had her pick out the glasses, and then had her put the glasses on. And it was so neat being a part of that, Leslie, knowing that we could make a difference in her life in the future.
And we take such for granted.
Exactly, that she would never have access to. Yeah, great memory.
A best memory for you, Dr. Baldie?
Well, for me, also in Peru, had a great experience, and the culture there, where the people were so selfless, especially in the town of Iquitos and Nauta as well, where we worked. They weren't, asking for much. It was just more, they were so happy just to have us, and grateful for us to just be there, knowing that there's doctors that are coming from, the States and, Western world that just want to be there to help them.
Now, speaking of coming from the States,
yes.
Could you sense at all, we hear a lot of different things in people, and people running for office will say things about America and that, we're not great anymore and all of that. But what do you, when you go to these places and they know you're doctors from America,
right.
What is your sense of what they think of America?
What do you think? And it was very good, I think, don't you?
Yes,
Yeah.
yes. They had a very high opinion of America. Those that met us, they were very, again, just grateful for us
Very
to be
excited.
there. I guess they figured that we were living the life in here, and we had a great conversation with one of our the physicians that actually works down in the Iquitos area. He came down with us to Nauta, and he was pretty amazed at how much money doctors actually make in this country. He's like, even on a monthly basis, because a monthly salary or a monthly income that a doctor makes in this country could be equivalent to what he would make in a year. And he told us this, and it was very fascinating. And the fact that we were able to carry around, otoscopes and different tools and instruments that we could have ready at hand to work with patients and help diagnose their ailments, was fascinating to him as well, and how much those items cost, because he was just used to a lot of the hand work. He didn't have a stethoscope when he was down there with us. It was basically, his physical exam, his hands, his eyes, were his tools. And
but very accepting.
He was very accepting of that too.
In just a couple minutes that we have left, I'm going to ask each one of you a question and ask for a 2 or 3 word answer, which I know is not fair, but I say that in advance.
There's so much to say.
Okay. What would surprise us most, Dr. Plate, about what you missed from home?
What would surprise you? You want me to say what it was? A toilet. A toilet and toilet paper. What a privilege.
Dr. Baldie, tell us what was most special about Haiti.
What was most special about Haiti was just the rich history, the culture that those individuals displayed, and the fact that just seeing the children there and the smiles on their faces when we were able to provide them with their stickers and such, so, and toys.
And Dr. Plate, in a few words, what was most memorable about Peru?
Peru, most memorable. As Kevin indicated, the graciousness of the people. To see someone make a difference, treat them, and then have them embrace you was absolutely priceless.
What was the first thing you wanted to eat when you got home?
First thing I wanted to eat when I got home was Chick-fil-A. Yeah.
And in a few words, next mission. Are you planning your next mission?
We're very pleased with this group, this Amazon Promise group. They do so many things in Peru and all throughout Peru. I've been in touch with her. She's actually come and visited us at Akron General. So we're looking forward to having that be an annual event.
And my last question, with just 2 or 3 words, someone that had a sad memory. Is there a sad memory of something that you couldn't do?
Yes. It wasn't actually directly a patient that we were working with while we were in the Nauta area, but we were brought to, when we went back to Iquitos to a hospital, and there was a gentleman that had been seen and worked up by the team in Iquitos that was developing ocular cancer in his eye, and it was really bad stage cancer for him. He was basically losing all this weight, and he didn't have any, tools, and they were trying to bring him to Lima and provide them with the resources to bring him there, but he wasn't, it didn't look, the prognosis wasn't that good for him. And
but it was for many people.
That's right.
So let's leave on that note. It was for many people.
Oh, that's right.
Absolutely.
Very good.
Thank you to my guests, Dr. Deb Plate and Dr. Kevin Baldie. Both of these guests possess the special quality that powers them toward difficult situations rather than away from difficult situations. Recently, they have made medical missions to Haiti and Peru, doing good and leading and teaching good wherever they go. Thank you for joining us today on Forum 360, the show with a global outlook and a local view. We're co-sponsored by the Shaw Jewish Community Center. I'm Leslie Ungar. Join us again in the near future as we bring you another gem from the landscape of Northeast Ohio.
Forum 360 is brought to you with support from Electric Impulse Communications, Kim and Harvey Nelson, Rubber City Radio Group, Acronist.com, Hudson Cable, Medical Mutual of Ohio, Forum 360 supporters, and the Shaw Jewish Community Center of Akron.